ALPORT syndrome is a genetic disorder. Look at this picture, shows that effects of ALPORT syndrome: ear, eyes, heart, kidney. Then disease mechanisms. Look at this detail going on. Introduction. ALPORT syndrome is a rare genetic disorder that affects the kidneys, eyes and ears. It is characterized by progressive kidney disease, hearing loss, eye abnormalities, often leading to end-stage kidney disease by adulthood. It was first described by Dr. Cecil ALPORT in 1927. The disorder is caused by mutations in the genes responsible for the production of type 4 collagen, an essential protein in the basement membranes of the kidneys, ears and eyes. Definition: ALPORT syndrome is a hereditary disorder primarily involving the kidneys, characterized by glomerulonephritis, progressive kidney failure, sensorineural hearing loss, and various ocular abnormalities. The disease arises due to mutations affecting type 4 collagen, disrupting the structure and function of basement membranes in key organs. Types. ALPORT syndrome can be classified into three main types based on the mode of inheritance. 1. X-linked ALPORT syndrome, most common from about 80 to 85% of cases, caused by mutations in the COL4A5 gene located on the X chromosome. Males are more severely affected because they have only one X chromosome, while females typically have milder symptoms due to the presence of second normal X chromosome. Second type, autosomal recessive ALPORT syndrome. Approximately 10 to 15% of cases caused by mutations in COL4A3 or COL4A4 genes on autosomal chromosomes. Both copies of the gene must be mutated for the disease to manifest, after male and female equally. 3. Autosomal dominant ALPORT syndrome, rarest form, 5% of cases, caused by mutations in the COL4A3 or 4A4 genes. Symptoms are usually milder and progression of kidney disease is slowly compared to the other types. Causes: ALPORT syndrome is caused by mutations in genes encoding type 4 collagen, which is a vital structural component of basement membranes in various tissues. COL4A5 gene X-linked for the majority of cases. COL4A3 or COL4A4 genes is autosomal forms. These mutations result in defective collagen proteins that impair the normal functioning of basement membranes in the kidneys, cochlea, inner ear and eyes. Risk factors: first, family history. Having a parent with ALPORT syndrome increases the risk of inheriting the disorder. 2. Gender. Males with X-linked ALPORT syndrome tend to have more severe symptoms than females. 3. Genetic inheritance and autosomal recessive cases. Both parents must carry a mutation for a child to be affected. Complications: 1. End stage kidney disease typically occurs in males by age 40 to 50 in X-linked ALPORT syndrome. 2. Hearing loss, progressive sensorineural hearing loss, usually starting in childhood and adolescence. 3. Eye abnormalities, lenticular cataracts and retinal changes. 4. Proteinuria, excess protein in the urine which can exacerbate kidney damage. 5. Hypertension, secondary to kidney dysfunction, contributing to cardiovascular complications. Pathophysiology. In ALPORT syndrome, the mutated genes lead to faulty type 4 collagen, which weakens the structure of the basement membranes in the kidneys, cochlea and eyes. In the kidneys, this results in thickening, splitting and scarring of the glomerular basement membrane, impairing its filtration function, eventually causing glomerulonephritis. Proteinuria and progressive renal failure. In the cochlea, it causes damage to sensory cells responsible for hearing, leading to progressive hearing loss. In the eyes, the lens and retina are affected, causing visual problems. The pathophysiology of ALPORT syndrome involves a series of steps that leads to progressive kidney damage, hearing loss and eye abnormalities due to mutations affecting type 4 collagen. Here is a step-by-step breakdown of the pathophysiological process. Step 1, genetic mutation. Mutations in type 4 collagen genes. Step 2, basement membrane dysfunction. Abnormal type 4 collagen disturbs basement membranes. Step 3, kidney damage. Glomerular basement membrane abnormalities. Initial symptoms, progressive glomerular damage. Step 4, cochlear damage, hearing loss, cochlear basement membrane dysfunction and hearing loss. Step 5, ocular changes, eye abnormalities, abnormal type 4 collagen in the eyes. Step 6, progression of renal, auditory and ocular symptoms, kidney function deterioration, eye abnormalities and visual impairment. Step 7, systemic manifestations, hypertension, cardiovascular complications. This progressive pathophysiology underpins the clinical features and complications of ALPORT syndrome. Signs and symptoms. 1. Renal symptoms. Hematuria, blood in the urine, often the first sign. Proteinuria, protein in the urine. Progressive kidney dysfunction leading to chronic kidney diseases and eventually ESKD. 2. Auditory symptoms. Sensorineural hearing loss, usually beginning in childhood or adolescence, often affecting high pitched sounds. 3. Ocular syndrome. Anterior lenticular bulging of the lens, cataract and other retinal changes such as maculopathy. For other symptoms, fatigue and weakness due to kidney failure, hypertension secondary to kidney damage. Diagnosis. 1. Clinical examination based on family history, hearing loss, hematuria and renal function. 2. Urine analysis. Detect hematuria and proteinuria. 3. Kidney biopsy identifies characteristic basement membrane changes, thickening and splitting of GBM under electron microscopy. 4. Genetic testing, identifying mutations in the COL4A5, COL4A3 or COL4A4 genes. 5. Hearing test, audiometry to evaluate hearing loss. 6. Ophthalmologic exam, assess for anterior aticonus and other eye abnormalities. Nursing diagnosis. 1. Impaired renal function related to progressive kidney damage. 2. Risk for infection due to compromised immunoresponse secondary to kidney failure. 3. Anxiety related to hearing and vision loss. 4. Ineffective coping related to chronic disease management and potential for end-stage renal disease. Management. 1. Monitoring kidney function, regular assessment of serum criterion, glomerular filtration rate and urine protein levels. 2. Blood pressure management, use of angiotensin converting enzyme inhibitors or angiotensin II receptor blockers to control hypertension and reduce proteinuria. 3. Hearing aids for managing sensorineural hearing loss. 4. Dietary changes, low sodium, low protein diet to reduce kidney workload. 5. Dialysis or kidney transplantation in cases of end-stage kidney disease. Treatment. 1. No cure. There is no specific cure for ALPORT syndrome. Treatment focus on managing symptoms and slowing disease progression. 2. ACE inhibitors, ARBs, to control blood pressure and protect the kidneys. 3. Hearing aids, cochlear implant for sensorineural hearing loss. 4. Dialysis or kidney transplant for end-stage renal disease. 5. Ocular surgery for cataract or other vision impairments if necessary. Psychosocial medicine. 1. Family support, since ALPORT syndrome is genetic, addressing the emotional and psychological needs of families is essential. 2. Patient education, explaining the progressive nature of the disease and the importance of regular monitoring. 3. Social support, connecting patients with support groups for chronic kidney disease, hearing loss and genetic conditions. 4. Mental health care, providing psychological support for coping with the chronic aspect of disease, especially the prospect of hearing loss or kidney failure. Prevention. ALPORT syndrome is a hereditary disorder that significantly impacts the kidneys, hearing and vision. Early diagnosis and interventions are critical in slowing the progression of kidney disease and managing symptoms related to hearing and vision loss. With advancements in genetic testing, there is hope for more targeted treatments and management strategies in the future. In conclusion, ALPORT syndrome is a hereditary disorder that significantly impact on kidneys, hearing and vision. Early diagnosis and intervention are crucial in slowing the progression of kidney disease and managing symptoms related to hearing and vision loss. With advancements in genetic testing, there is hope for more targeted treatments and management strategies in the future. Genetic counseling remains an important aspect for affected families to understand the inheritance and implications of the disease. Thank you. Have a nice day.